How are rehabilitation programs tailored to osteoarthritis severity? When it comes to osteoarthritis, rehabilitation programs are not one-size-fits-all. They are carefully tailored based on the severity of the disease, the specific joints affected, and the individual symptoms and functional limitations of each patient. The primary goal is to reduce pain, improve joint function, and enhance quality of life, all while considering the progressive nature of osteoarthritis. The process begins with a thorough assessment of the severity of osteoarthritis. This may include evaluating pain intensity, joint stiffness, range of motion, muscle strength, and functional disability. Tools such as pain rating scales and joint angle measurements help quantify impairment. More severe osteoarthritis often means greater joint deformity and reduced mobility, which may require more intensive or specialized interventions. For patients with mild to moderate osteoarthritis, rehabilitation typically includes low to moderate intensity exercise programs. These focus on improving muscle strength, especially around affected joints like the knee or hip, as well as enhancing joint flexibility and aerobic fitness. Common exercises might include strengthening activities for the quadriceps, range of motion exercises, and low-impact aerobic activities such as walking or cycling. Research shows that dynamic neuromuscular stabilization exercises can lead to better improvements in pain and mobility compared to traditional exercises for knee osteoarthritis. In cases of severe osteoarthritis, where there is significant joint damage and disability, exercise programs are tailored more cautiously. The focus shifts to maintaining as much function as possible, managing pain, and preventing further disability. These programs may involve more supervised, lower-intensity exercises combined with methods like hydrotherapy or the use of assistive devices. Functional training to improve gait and balance becomes especially important. Rehabilitation also takes into account psychological and social factors that can impact a patient's ability to stick with physical activity. Issues like fatigue, depression, and pain perception can affect participation, so programs often include behavioral strategies such as goal setting and self-monitoring to encourage long-term engagement. The mode of delivery for rehabilitation can vary based on patient preference and severity. For mild cases, group or home-based programs may be suitable, while more severe cases might require individualized therapy sessions. Technology-assisted or online programs can also complement traditional care, especially for those with mobility challenges. In addition to exercise, various physical modalities may be used to alleviate pain. Techniques such as transcutaneous electrical nerve stimulation, ultrasound, or heat packs are often integrated into rehabilitation for moderate to severe osteoarthritis. Finally, rehabilitation is not static. Programs are regularly reassessed and adjusted based on how the patient responds, the progression of osteoarthritis, and changing goals. This ensures that interventions remain safe, effective, and aligned with the patient's functional status. In summary, rehabilitation programs for osteoarthritis are individualized and progressively adapted to the severity of the disease. They combine exercise, behavioral support, and pain management to optimize outcomes. This tailored approach respects the varying degrees of joint damage and disability seen in osteoarthritis, aiming to maintain mobility and reduce pain through evidence-based, patient-centered care. Always consult healthcare professionals for personalized advice and treatment options.